Hi, welcome. Thanks for joining us here on Zoom today. This is the ARC of Fort Bend County's Parent Education and Support Group meeting. My name is Carrie Axtell, and I'm the Advocacy and Youth Programs Director here at the ARC of Fort Bend County. We are a nonprofit organization and we're dedicated to grassroots advocacy. We provide family support and a variety of different social and recreational programs from youth, teens, all the way through adulthood for people with intellectual and developmental disabilities or IDD. If you'd like to learn a little bit more about the ARC and what we do here at the ARC of Fort Bend County, you can visit us at arcoffortbend.org. And then if you'd like to also follow our social media, Facebook, Instagram, we're pretty active on those channels as well. And then for today, anyways, we're very happy to have an excellent presenter here with us, Lauren Lynn with Texas Health and Human Services, to present about the Children's Autism Program. And in the meantime, if you have any questions, if you want to put it in the chat, I will read questions at the end when Lauren's done with the presentation. Or at the end, if you'd like to unmute and ask the question yourself, you're welcome to do that as well. But without further ado, I'll let Lauren go ahead and get us started to learn more about the Children's Autism Program.
All right, great. Well, thank you so much for having us, and thank you, Carrie, for the invitation to present. Um, as she mentioned, my name is Lauren Lind. I am the program manager for the Texas Health and Human Services Children's Autism Program. We are located statewide. I just happen to be in Austin, as is the rest of my team. We are a small but mighty team of three. And we are located in kind of central Austin. And but our program technically serves kids statewide. We have contracted providers all over Texas. Okay, and we'll go to the next slide. Okay, so a little bit of an overview about the program. The Children's Autism Program provides focused ABA services, applied behavior analysis services through local agencies and organizations. The focused ABA is what is commonly referred to as treatment, targets specific behaviors, and is used to improve social and adaptive skills. So if you have any familiarity with ABA, it is kind of the industry standard for autism type therapy or treatment. This program in particular is considered a gap program that kind of steps up and fills in when a child would not have access to ABA in particular otherwise. And we do consider our services focused, as I mentioned, and focused really just means that the behavior plan team would find certain behaviors that they want to specifically treat, and then the services are focused on that behavior moving forward. Okay, so before some details about the program and how it works, I'll give you all a brief overview of autism spectrum disorder, its signs and symptoms, some statistics, and the testing and diagnostic process. So as of, I would say, mid to late last year, 1 in 36 children has been identified with autism spectrum disorder. As its name kind of gives away, it is a spectrum in the sense that it has really, really varying degrees. In general, ABA or applied behavior analysis can apply to a child on the spectrum of any sort. It has kind of its place regardless of where they fall on that spectrum. Common autism symptoms typically develop in a child before the age of 3. That is not exclusive. Sometimes it's later than that, but it is often before the age of 3. And of course, the symptoms, like a lot of other disorders or disabilities, vary by child and are definitely case to case. But these are kind of like the general ones that you see or that you would often think of when you think of ASD. So delayed communication skills, difficulty with eye contact or holding conversations, difficulty with reasoning skills, very narrow interests, inflexibility, and or poor motor skills, among other things. These are just kind of the common ones that come up fairly often. Okay, so as far as testing and diagnosis goes, there are no medical tests, such as a blood test like you would do for diabetes, for example, to diagnose autism. Diagnosing the autism spectrum disorders of any sort involves several steps from kind of a holistic team of sorts. So doctors and healthcare providers rely on data such as evaluation and observation of a child, working with the caregivers, doctors, and other paraprofessionals on that child's team. So one part of the process is developmental monitoring, which involves observing how the child grows and whether the child meets the typical developmental milestones or skills that most children would reach by a certain age. And those are most often specifically in playing, learning, speaking, behavior, and moving. Another part of the process is called developmental screening, and it's a little bit more formal than developmental monitoring. It's a regular part of most well child visits, even if there is not a known concern. So this is something that a pediatrician would typically be doing at a well child visit for a young child anyways. But if there is kind of a reason for concern, they definitely, make an effort to do that at every visit. Screening questionnaires and checklists are based on research that compares the child with other children of the same age and where they kind of fall on that checklist. Questions may be asked of the family about the child's language, movement, thinking skills, as well as behaviors and emotions. The next part of the process is called developmental diagnosis. This includes a brief test using a screening tool, but does not provide the diagnosis itself. It can indicate whether a child is on the right developmental track according to typical milestones, or if a specialist should kind of take a closer look and go to that next step of evaluation. So if the screening tool identifies an area of concern, a formal developmental evaluation may be needed, and that is most typically done by a developmental pediatrician or a developmental psychiatrist or psychologist that specifically works with children. Okay, so switching gears a little bit to more program-focused information. This is some details about our eligibility criteria. So at this time, the program requires that a child must be a resident of Texas, is 3 to 15 years old, and by that we mean that the services in this program would end on the child's 16th birthday. And the child must have a documented ASD diagnosis from a qualified professional. And the program defines a qualified professional as more often than not a developmental pediatrician, psychiatrist, psychologist, or neurologist. Those are really the big professionals that I would say we see most often that are providing a diagnosis. If for some reason, I always like to highlight this, if for some reason a family, maybe their school or, just kind of more casually, someone is suggesting that a child may need further evaluation, we can provide information on where a child could seek out an evaluation and a diagnosis. Our program does not provide the diagnosis ourselves. But we can give some resources depending on where the family lives and all that good stuff. So the program services specifically for the Children's Autism Program, again, are considered applied behavior analysis or ABA services that target specific behaviors instead of the broad scope of all developmental needs. There are other ABA providers that kind of do both or do like all encompassing. This program specifically is focused mainly because, again, we are meant to fill a gap. So the idea is that the type of services that the child needs, they would not have access to otherwise. And that's when this program can provide support, assuming they're eligible, of course. So our contracted providers are selected through a competitive procurement process. If you're familiar with a request for application or RFA, that is how we, excuse me, pursue our contracted providers. We actually just completed a new contract cycle, or I should say we just started a new contract cycle in September. And so we have a great list of providers that are statewide. A few of them are new to the program, and several of them are returning contractors as well. They provide the services either at school, home, at the provider's facility or clinic, and or telehealth. Sometimes it's a combination of all of those things. Sometimes it's one. It depends on the provider. And of course, it depends on the child as well. At this time, the services for the Children's Autism Program are limited to 180 hours per calendar year and a cap of 720 hours before age 16. So essentially, the lifetime of the child's case, according to the eligibility ages right now, is that they would quote unquote max out at 720 hours. And I also like to remind everyone here that, as I mentioned earlier, the Children's Autism Program is considered the payer of last resort. So the program may be utilized by clients that are uninsured and those that are insured if eligibility criteria is met. So, for example, just because, as we all know, just because someone has insurance doesn't mean it pays for either at all what someone needs and or enough of what they need. So we do see sometimes families that have insurance, but they don't have access to this particular service for whatever reason, or at least sometimes, you're changing insurance, you lose coverage for a period of time. There's all sorts of kind of different situations that would make a child eligible. So I always encourage someone to reach out to us if they're not sure, whether it's a provider, a family, um, really anyone that's interested or has a question, you are always welcome to reach out to us and ask, and we'd be happy to walk you through it. Um, if you happen to kind of access the program the other direction, so you happen to have a connection with one of the providers, they let you know about the program, they can also walk you through it as well. As I mentioned, our program providers are statewide, as you can see on this map. We have 21 contractors with either clinic or telehealth locations that cover the entire state. Um, as of last fiscal year, the Children's Autism Program served about 800 clients annually across all of the providers. Um, with that being said, we do have a provider for anyone in Texas, technically, that is eligible. Of course, depending on where the person lives, may change how geographically close that provider is. But regardless, we always want to make sure that we make the connection for the family to the provider so that we can at least get that relationship going, get the ball rolling, and hopefully get them in services however they really need them to be happening. And I mentioned earlier, but I'm going to share specifically after the presentation, my presentation slides that can be sent out to the group, as well as a list of the contractors that are relevant to the Fort Bend County area and kind of surrounding area. So those are the contractors that if you had reached out to me and said, I live in such and such county, who should I reach out to? That's who I would send you to. And the list I send will have the counties that each contractor covers and their phone number. If for some reason you're having trouble, can't find it, whatever, you can always ask one of us, myself or my team, and we'd be happy to help you. So the best way to access services, technically there's a few different directions you could take. My personal kind of first choice is that a family either reaches out to me or the program inbox directly. The program inbox is listed here, but it is childrens.autism.program@hhs.texas.gov. I will also share that when I send the slides and the contractor list after the presentation. You can reach out to that inbox. It's monitored by myself and my team at any time with questions, wanting more information, etc. We also have a program phone number. It is 512-438-5356. That is monitored by someone on my team, and she will, if she can't answer right when you're calling, it takes a voicemail, sends her an email, and she gets back to everyone that reaches out to that phone line. You can also technically access the information on 211 to get kind of connected with the program, or it'll have that same, it'll have the website, the inbox, the phone number. But I always encourage people to save yourself some time and reach out to us directly. Um, I wanted to touch on also who can contact us or who could provide a referral. Um, in a way, really anyone. It's often either a therapist on the child's team, a primary care doctor, a social worker, case manager, and often families are self-referring themselves. And when I say referral, I mean they reach out to us for the information to contact the contractor. Um, but the contractor is really the one that determines eligibility, does the intake, and gets services moving. So we're kind of that connection or middleman between the two. So this is a little bit more detail of what the client services might look like once a child is enrolled. So when beginning services, families can expect to connect with the local area provider, as I mentioned, who will start the enrollment and eligibility process. All program providers will enroll the child into services, determine eligibility, and walk through the program expectations with the family. An ABA-based treatment plan will be developed and focused on identified target behaviors or focused behaviors. Providers will also facilitate required caregiver training with the child's family in order to increase success of the child's treatment plan. While the child is enrolled in services, all providers will treat the program again as the payee of last resort and bill third parties and then the children's autism program. Like I said earlier, normally what we see if a child has another resource is they bill insurance and then they bill us. Providers document services provided using their own internal client record system as well as the children's autism program database. Once the target goals are met, the child and the family are discharged from the program, and that is always the ultimate goal, is that things are going well and progressing, and that the child eventually, essentially doesn't need the program to fill the gap anymore. All right. This is a little bit more information about program resources that the Children's Autism Program has available. So kind of underneath the umbrella of the Children's Autism Program, we have a kind of resource guide called the Texas Autism Research and Resource Center. The Children's Autism Program provides information on published research and community resources relating to autism. And this page includes links to PubMed on topics such as early identification, employment, etc. Also included on the TARC is what we call it website are opportunities for families to participate in research that's related to autism by joining a clinical trial or enrolling in a research study. This is just some insight of resources for the autism contracted providers that we have. It includes things like access to the program overview, policy manual, a link to sign up for the email list, and other program-related documents. As I touched on earlier, Texas Medicaid does cover applied behavior analysis and other services for children with autism. So we try to make sure that every family has that information as well if they don't already. The link to the Medicaid ABA flyer can also be found on this page in English and Spanish. And I wanted to give a quick plug for last year in 2025 that the program had a really successful virtual conference that we shared published and kind of developing research from our contracted providers that they're either currently working on or maybe finished in the last few years. It was held over 4 days. We had total between like 300 and 500 attendees each day. It was amazing, and it went really, really well. And I'm very proud of the research that we were able to present. So we are planning on hosting that again this year. This time it will be in June. And as soon as I have kind of the save the date, the invitations, all that good stuff, I will make sure that the Fort Bend County ARC is on our email list for sure, so that anyone that is interested is welcome to attend. Okay, and I have plenty of time for questions. I wanted to add again that I'm going to send out the presentation, the contractor list, and my contact information, as well as the programs. So if you like forget right now and think of something later, you're always welcome to reach out after as well.
Yeah, great. Thank you so much, Lauren.
Mhm.
So one of the questions was still kind of touching on how this intersection of, let's say the person has Medicaid, and yes, the
Uh-huh.
Medicaid might include some ABA therapy. So how would a person who has Medicaid per se, and then how would they still take advantage of your program? Maybe once Medicaid is not paying for it, or how
Yeah.
does that work?
So, as you could guess, it's kind of individual depending on the coverage, what the child's assessed for, what they need. All those, it can be kind of a perfect storm of several things working together. However, we always start with contacting the program. We'll connect the family with the provider that applies to them. And then we see if what the services being requested are, if they meet what Medicaid is covering. Sometimes they do, sometimes they don't. It just kind of depends. And then we go from there. So if Medicaid is billed and they're getting what they need and the family is happy with how things are progressing, then great. If Medicaid is billed and the child, still needs kind of additional support on certain behaviors, that's when we could step in. So regardless, I always, whether someone has Medicaid, insurance, whatever, um, I always encourage families to reach out to either us or the provider to at least kind of see where they land on that. I will say all of the providers take the family's income information. And so if a family does have to pay, it's on a sliding scale, but the family always pays the lesser amount. So if their deductible happens, for example, if their deductible happens to be $40 and their cost share according to their family size and their income is $15, they're always going to pay $15, not 40. So we work that out depending on kind of where people fall in that spectrum of things.
Okay, okay. So it does sound good to reach out to you
Yes,
all no matter what. So if they
definitely.
were to contact you, like either through the website or by calling
Mhm.
you all, is there an application that they would fill out with you all? And
Good
then,
question. So as far as an application goes, specifically for us, like that we are processing on the HHS side, no. We just take some very basic information, and more importantly, it's really where the family lives. And then we connect them with the provider that would apply to them, and then they handle all of the kind of paperwork sort of things.
okay. And then I'm just imagining perhaps, let's say they do have Medicaid or a private insurance
Uh-huh.
company that is providing some type of ABA therapy. And then maybe if that provider is already also a provider
Uh-huh.
authorized through your program, then maybe
Yes.
they can kind of get the best of both worlds there.
Yes, and if it works out that way, it is yes, it's very nice and a lot easier on the family to navigate for sure.
Right, right. Okay, very good. And then I was hoping, I was noticing back when we were talking about the eligibility and
Hmm.
it's from 3 through, I guess, or until they turn 15, but then the 720 hours is used by the age of 16. So how is that like,
So they are eligible from 3 till their 16th birthday. So like that
oh,
whole
okay,
year that they're 15, if that
okay,
makes sense,
gotcha.
um,
Okay,
still counts. But yes, the 720 hours applies to all, every year between 3 and 15, the total sum. Um, And then the annual hourly cap is just each year and then it starts over.
okay. Good deal.
Good
Thank
question.
you.
Yeah. I'm
Um,
gonna go to the next slide I like to end on just
yes.
because it has the phone number and inbox again. Um, again, this will be available later, but just in case anyone wanted to see it again.
Yeah. We do have some more good questions on the
Yeah.
chat about, so does the family, when they do, if there is a cost sharing portion where the
Mhm.
family does pay, do they pay the facility directly or does that go through your program
Good
too?
question. So that is all navigated through the facility. We kind of, so the parent pays the provider directly, and then our program and the provider handle all of that, like kind of background billing stuff. So all they have to worry about is paying the cost share if they have a cost share, and then we handle all of the nitty-gritty billing with
Okay.
the provider.
Okay. So the family, if some is due, would pay the provider
Correct.
directly. Okay. And then you mentioned, so there is a list online of facilities that participate in this program by part of state that you're in?
So there is a list, but I always encourage people to, when in doubt, reach out to us for the most current version.
Okay.
depending on which, as you can imagine, sometimes updating government websites is a little tricky. So we as in the program staff, always have the most current version. So when in doubt, reach out to us and we'll make sure you have the most current information.
Okay. And then maybe also if you happen to already have an ABA provider that you're dealing with, they may or may not know if they are also a
Yes.
partner with your
And
program.
yes, that's a good point. And if they are, they would definitely know. They'll know that they have a contract with us. And if they're not, then that's when you could go, okay, so I'll need to reach out and find out who would be instead.
Okay. Another just kind of question about how all this works, like the Medicaid program.
Uh-huh.
I understand, I guess that it is the service provider themselves, like the ABA professional themselves that is um, kind of qualified through to be a Medicaid service provider. So if that
Yeah, as in,
person or therapist leaves,
uh-huh.
then they no longer, it kind of follows the provider, not the facility itself. So is it similar for you all, like who's contracted or with you all? Is it by the facility or by the ABA provider who is?
Good question. It is by the facility, or you could kind of consider it like the business. So if, for example, one of our providers in kind of the general Houston area is Texana Center,
Okay.
Texana Center is a provider for us, right? So that means that any RBT or any BCBA is considered a contracted provider with us. So it's not individual to the person, it's individual to the business.
Okay, good. So that is one distinction, I guess, for
Yes.
Medicaid. Yeah.
Yes.
All right.
Good question.
Lots of
No,
lots of
those are great
detailed
questions.
questions for you.
Yeah. Those
Uh,
are things that not everyone thinks about. So I'm happy to answer.
well, this has been a very informative, helpful session, and it's great to see that there's even more resources out there for our children. And then another thing, maybe if you hear of anything or if there's ever feedback for Texas Health and Human Services about maybe even expanding this to adults somehow or young
Yes.
adults,
That
because
is
we
a common request that we get. And it's I will say what I can say is it is a long-term goal. I would love to be able to make this program at least older teenagers and young adults. That is a goal of ours. So I'm fingers crossed that we can get there.
it's good to hear that that's on the radar because that's
Yes.
definitely an area of need.
Oh
Um,
yeah, for sure.
but glad to see this goes at least through the age of 15 because it seems like those, especially those years of puberty, right? 11, 12, 13, 14, 15, those it's more complex for them developmentally. And so not
Totally.
only do you have,
Yep,
autism spectrum disorder, but then biologically what the body is going through
yes,
on top of it.
definitely. And I feel
Yes.
like we often have noticed and we've heard from contractors that there's also kind of this like subset group of children that maybe weren't diagnosed right away. And so they're kind of getting into services a little bit later than some of the other kids. And so um, they kind of fit in that group as well, right? That maybe they didn't get a diagnosis at 3, 4, 5. It was more like 10, 11, 12. And so they still have a good chunk of time that they can get services with this program, or at least we can kind of give that foundation before we kind of transition them to either a different provider or the same provider, depending on what they need.
Yeah. And that's another observation that we, families find too. It can be very difficult to find ABA therapists or
Hmm.
RBTs that will accept children after age
Yes,
10, 11, 12.
yes,
So that is
very
a challenge.
common difficulty for sure.
So it's good to, if nothing else, reach out to you as well. Maybe you might know
Mhm.
about some providers that serve that age group as well.
Yes. And we also kind of have, which I'm sure you all do as well, but we also kind of have just general resources that we always offer families that maybe they're not specifically an ABA provider, but just support for a family of a child with disabilities in general, to make sure that they have access to information on kind of a whole variety of things too.
Right. Right.
Yeah.
Any other questions? Great questions in the chat. Thank y'all for providing that, that feedback. And Lauren, thank you for sharing just your information and for being part of this program. It's
Of
really
course.
important and we appreciate it.
Of course. No, I am, again, grateful for the invitation. Happy to be here. And please don't hesitate to reach out to us if anyone has any questions. And I will send all the information to Carrie after we're done today. And that way you all have it to reference as well.
All right, real good. Well, thank you so much.
Thank you again.